Breast cancer is the most common cancer amongst women. However, if we diagnose it at a very early stage, it is a very curable disease. My name is Dr. Wong Chiung Ing. I'm one of the medical oncologists at Parkway Cancer Center. Today, I'll be talking about breast cancer. Breast cancer happens when there's abnormal growth of breast cells. In the normal circumstance, our cells replace themselves through a very orderly process. That is, the new cells replace the old cells, and it is controlled by a very strict mechanism. When this mechanism is disrupted, either due to an aging process or when there's mutation in the genes, the cells cannot replace itself or cannot be destroyed. When the abnormal cells are not destroyed, it will go through very uncontrolled growth, and this forms a tumor, and hence breast cancer. Breast cancer is a very treatable disease. However, the chance of cure depends on the stage of diagnosis. There are 4 stages of breast cancer. Stage 1 is when the breast cancer is confined in the breast. Stage 2 and 3 is when the cancer has spread to neighboring lymph nodes. Stage 4 is when the cancer has actually spread to distant organs. So if we diagnose the cancer at an early stage and give prompt treatment, either through surgery, chemotherapy, radiation therapy, hormonal therapy, the chance of cure can be up to 95% or more. More than 80% of breast cancer is actually caused by hormones, and this hormones is called estrogen, which is produced in the female body. The unmodifiable causes are that of gender. The other unmodifiable factor is age. As we grow older, our cells cannot repair itself, and therefore there's a higher chance of developing breast cancer. The other risk factor that we are concerned about is family history. If you have multiple family members who have developed cancer, there may be a risk of a genetic mutation in the family that predisposes you to developing cancer. The good news is, however, there is some modifiable risk factors that can reduce the risk of you developing breast cancer. Do not be overweight, exercise regularly, limit alcohol, and make sure that your diet is rich in vegetables and more in fiber. If you have been pregnant or you have breastfed your children, that is good news, because during this period of time, your hormone levels are actually less, and actually that reduces your risk of breast cancer. It is definitely possible for breast cancer patients to recover from their disease and be cured. You will not be infertile, as this will not affect the estrogen production, and you can still breastfeed your child on the other breast. After breast cancer treatment, I will usually advise my patients to wait for about 1 to 2 years before they try to get pregnant. This is because cancer recurrence usually happens within the first 2 or 3 years. We would like to make sure that the patient is in remission before they try to conceive for a child. Any cancer treatment can actually cause birth defects, cause harm to the fetus, and even cause miscarriage. It is therefore advisable not to get pregnant during cancer treatment. The toughest part of my job is to see a young woman die from breast cancer. Unfortunately, breast cancer is being diagnosed earlier and earlier, probably due to a combination of reasons such as diet and multiple environmental factors. However, I'm thankful and relieved to know that we now have a lot of treatments that are available to be able to detect the cancer early and to give treatment promptly. So it is important for patients to be vigilant of their symptoms and go for regular screening. What I enjoy most is to be able to walk the journey with my patients and see them get well, be cured, and enjoy time with their family and loved ones.